And we are live. Hi, good evening, everybody. Welcome to She Built It Boss Lady Chronicles. I am Dr. Sharita Gaskins-Tillett, and this is the show where we feature the amazing stories of women who are owning their power to transform their lives. And so I am super excited about tonight's guest. We've had to reschedule a couple of times, and so I'm so glad to finally have her in the studio tonight. I just want to give a couple of minutes for others to log on. I know it's been a while since I've seen you guys. I hope everything is well, and I'm glad to have you back with us. If you're watching us live, please say hi in the comments, ask your questions. I'm sure our guest is happy to answer questions. If you're watching the replay, hashtag replay, and still put your questions in the comments. If you're watching us on YouTube, don't forget to hit that subscribe button and to share this episode with your friends. So, without further ado, I am going to introduce tonight's guest. So, I have joining me tonight Dr. Dewan Carpenter. Dr. D is a dually board certified physician specializing in physical medicine and rehabilitation and expertise in lifestyle medicine with a passion for advancing patient care through innovative regenerative medicine techniques. With 10 years of experience in musculoskeletal health and functional restoration, experience in hospital and office based settings, Dr. Carpenter combines evidence based practices with cutting edge therapies to help patients achieve optimal recovery and improve quality of life. Welcome, Dr. D.
Thank you. So good to finally have this episode.
Yes. Thank you for coming on. I'm so glad that you were able to join us tonight. And we were just speaking off camera about how you've been pretty busy lately. So I know one thing that I noticed was not in the bio that you gave me, and that's a new practice that you've launched, right?
That is correct.
So
Yes.
tell us about that practice. What's it called? Where is it? What do you do there?
The practice is DJC Medical Group, and it is the combination of physical medicine and rehabilitation, which is focusing on restoring function. But the main thing has been lifestyle medicine. Because in my hospital work, I work with patients in the rehab hospital before they can actually go home after, major life changes, surgery, strokes, things like that. And one of the things that really kind of birthed this was I was just frustrated that I was seeing the same people, like in my field, in the hospital setting, you shouldn't be coming back and for the same thing. And it was just frustrating. I felt like, just everybody let these patients down.
Hmm.
And, what can I do about it? And the more and more that I researched, talked to colleagues, prayed, I don't know how many times God probably was like, listen, I tried to tell you years ago what you were supposed to do, and it was birthed out of that,
Okay.
because I felt that what I saw as solutions and what I felt patients needed and deserved that didn't exist was something that I was going to have to kind of create. And that's really where it came from, because Lord knows I was not trying to jump into full entrepreneurship with a practice. That was not my vision, at all.
Okay.
But it's been something that has been so needed, because I think just in healthcare in general, we really are, a lot of the things that we have now are band-aiding people.
Yes.
And, I never believed in that in my personal life. And so, being a physician and things like that, and actually learning the science behind it, it's like something's missing. And I've found lifestyle medicine for me has been that bridge of what was missing, because it incorporates not just the medicine, not just eating right, not just exercising, but everything. How's your stress? Are you sleeping, and what's the quality of your sleep? And do you have good social connections? I mean, If we
Right.
didn't learn anything from COVID, we know that the social connections, good or bad, play a major part in your overall wellness. And, personally, because I'm a woman of faith, I have to add in spiritual. So I do talk with my patients about, spirituality and, pray with them and things like that, because I feel like that is the whole total package. And that's really what I feel like, people really need to live their best self and their best life.
Absolutely. I couldn't agree more. So I'm curious to learn more. Tell me about some of the patients that you've seen now in the new practice and some of the outcomes that you've realized. I know you haven't been open for very long, but tell
Hmm.
me some of the things that you see in implementing this new strategy or different strategy.
Absolutely. So, because we are just kind of starting, where most of what I do is telemedicine, but we focus on, for a lot of people, it's been weight loss. Especially us ladies, we've had, some kids and kind of don't have our figure where we want it. Usually people come to me for concerns about their weight. So one particular patient has, you know, changed their life in the sense of, walking now, doing more exercise on a consistent basis, but history of diabetes, previously PCOS, and just kind of trying to figure out why is this not working? Like I feel better, but I'm not getting the results that I want to see. And what we do again is take all of those areas. Okay, we focus on nutrition. Now, the disclaimer is obviously I'm not a nutritionist and things like that, but I do have other people that I say, hey, if you need some specifics, this is who I recommend, you talk to get a diet specific. But generally speaking, I can work with people with, okay, here are some things that we focus on. So one of the things is lifestyle medicine focuses a lot on plant predominant and the benefits of plant proteins and things like that. And so, I encourage this particular patient, you don't have to go vegan or whatever the different names are and just all you do is plants, but here are some benefits, especially in your case, of incorporating more plants as opposed to animal protein specifically to help with that, because again we know that um, the farming markets, the animal markets, and things like that, they're not the same. And there are things that we're getting in our food that contributes to, the
Sure.
diabetes and the insulin resistance. And so that was one thing. Even, her walking, switching up. It's great that you walk 30 minutes every day. How can we level that up a little bit and
Mhm.
incorporate some, weights and toning in it? Again, what we know is, especially 40 and up, what worked for you when you were 20, you could just go walk and whatever, it's not happening. You're not getting the same stuff. And
Right.
so a lot of us as women, because sometimes we shy away from the weights thinking it's gonna bulk us up, we miss out on some of those benefits too of incorporating some of the weight and things like that. So we haven't been working together for very long, but she has had some significant changes, in inches, definitely overall, mood, sleep patterns have improved. And, what we all want is more energy.
Yes.
When you make those changes, some of the things that you're getting from, the plant side, and we talk about eating the rainbow. So not just one thing, every day, but trying to make sure you're getting a variety. You're getting those phytonutrients and things like that you can't get from other places.
Right, right. And so I know. So I'm going to give a little bit of backstory. So Dr. D and I met a while ago, probably more than a year ago. And at that
Definitely
time,
more than a
she,
year.
yeah, at that time she was doing coaching. She's a twin mom. You have
Hmm.
twin girls, if I remember
Yes,
correctly, right?
yes.
Okay, yeah.
Twin
There's
girls.
four kids, twin girls. So she was doing a coaching program called Twin Mom Chronicles. And I was asking her off camera how she came from there to here. And you were mentioning that you were experiencing some burnout in your clinical practice, and you thought that some of the other things you were doing, utilization management and the Twin Mom Chronicles, that they would be a solution, but they weren't the solution. And I find that very interesting. Can you take us through that a little bit? Take us to the burnout, what that looked and felt like for you, and then the transition, as you will, to the utilization management and the coaching, and then the realization that you've now come to.
Sure. So the burnout, man, as you mentioned, having four kids, and I got a range. So currently, I now have an 18-year-old college student, which is hard to believe, a 14-year-old freshman, and then the twins are 7, so they're in second grade. But having the four kids, the span of ages, so literally doing teens and adolescent and everything all at the same time, being a wife and trying to take care of myself, which I didn't do a great job of. In clinical practice, I actually ended up putting off a major medical issue because I didn't want to leave work. I didn't want to leave someone else covering for me, right? Because what will they think if I actually have, a body that I need to care
If you're actually a human being, that
for?
part.
Correct.
Okay,
Correct.
just
Yes.
checking.
And I literally put it off so much so that had it not been at the time when I sought help, it was a major hurricane. So
Mm.
awesome timing. Had it not been for the major hurricane, our ER being already kind of overwhelmed and operating solely on the generator, and the infectious disease doctor knowing me and knowing that I would do what she said, I would have been spending a night or more in the hospital. So I had a very bad skin infection that literally it was almost to my bloodstream. Like, she was like, if you had of not come, I mean, she didn't even really even have to do a whole bunch of testing. She looked at me and was like, yeah, this is not
So
good.
I wanna actually stop you there, because I wanna
Hmm.
know, what is it that made you, I know you said you didn't want to, have people to have to cover and all of that, but what is it that made you put off taking care of yourself when you recognize, you're trained enough to recognize that you had something significant going on? What's going through your mind that says, I can just keep going? Where does that come from?
Um, Sheer craziness. I think it's I'm usually the caretaker,
Mhm.
and I don't want somebody else to have to take care of me. So it should be okay. I'm doing all right. It's
The
not that
other
bad.
the other my other thought, though, is the conditioning. When we go through medical training, at least I know as an OBGYN, we're conditioned to ignore every single need we might have, any
Hmm.
bodily function we might need to perform. That we're It's almost beat out of us that we don't matter. You don't
Yes.
matter. Everything comes before you. The patients come first. Whatever the hospital needs comes first. The paperwork comes first before you. And I'm wondering, is that part of what you were experiencing as well?
Oh, that's definitely part of it. And in full transparency, being a Black woman in particular, that is how my that's how my life in medicine started because I got pregnant with my oldest as a second year medical student. And from the moment the school was aware of that, it was a fight. I tried to do everything proactively to make sure it didn't disrupt and whatever else. And they were so negative, unhelpful. And I started my medical career fighting between being a person, being a woman, being a mom, and being a physician. And it was like the two of those things could not be. And
Yeah.
we talked about Twin Mom Chronicles. That was actually the inspiration for that as well. Was that as a mom, people say, "Oh, well, you can't have everything." And I actually find that to be false. You may not be able to have everything all at once, but to say that I have to sacrifice either being a physician or being a mom, sacrifice being a woman, a person first, or a physician is asinine to me. And
No,
that
I
definitely
agree.
was part of it. I felt like I needed to carry my weight. And what would people say? I got to go to the doctor and, all this kind of stuff. And honestly, um, I I went to the doctor and the doctor looked at me and was like, you are absolutely not returning to work.
Yeah.
So, I kind of in my head think, I wonder if she had have said, "Oh, okay, maybe consider not going back to work." I probably would have finished out the day and, probably would have gone back the next day had she not told me to you're off.
Yeah, and I
You're off.
think, and I wanted you to kind of elaborate on that because this show is watched by people that are not just in the medical field but other fields. And I think it's important for other physicians to hear, but I think it's important for everybody to know that to an extent this is a toxic culture, that
Mhm.
we are taught to ignore the things that we need. We're taught to neglect our own health, and we're doing the best we can to take care of people and at the same time not taking care of ourselves. I
Yes.
remember when I was a resident, one of my co-residents was ill. She had an IV in, and she was going to see patients. She would unplug the IV and go and see a patient and come and plug back into the IV. I have another friend who needed to have her pacemaker replaced, and like it was an emergency, it had stopped working, and she's like, "But I have to go to work." It's like, no,
Yeah.
no. I can't even explain how much it makes you not feel valued.
Mhm.
I in my retreats I teach this concept of the inner woman and the outer woman. And when the inner woman sees you neglecting her and choosing everything else over her, it makes you feel not valued.
Definitely.
Yeah.
Definitely agree
Yeah.
with that.
Okay, so I interrupted. So you were telling us about the burnout and all of that. So so you went to the hospital and you got your treatment. What came next?
So after I was released to go back to work, I definitely had kind of my wake up call, that realizing how close to really not being in this world I came. And it was okay, yeah, things need to happen differently. And I'm not putting myself off because this is going on, or neglecting my kids or my, family responsibilities because of this. And so I made a point to establish new boundaries. Prime
Mhm.
example of that is 2 weeks after I returned, I was supposed to have a trip out of the country. I was going to St. Lucia, and I was looking forward to it. Had to push it back due to the illness, but they were like, "Okay, that's no problem. Push it back a few weeks. It's not a big deal." I go to work, And my time comes up to be off, and the supervisor, this always makes me laugh because my supervisor in the clinical setting as a physician actually would be someone who would report to me in
Mm-hmm.
terms of titles.
Sure.
The supervisor says, "Oh, I see that you had time off coming up. Are you still taking that?" And I said with no hesitation, "Oh, yes, absolutely." "Well, you do know that since you were sick and things like that, so you used up most of your PTO." I said, "Okay. Well, that means that if you go for the days that you're going to be off, then you won't get paid." I said, "Okay." And they looked at me stunned.
Right.
I said, "Just to clarify, I'm going on the trip. I will be gone
Right.
regardless of whether there's pay, no pay, whatever. You do what you got to do because I'm certainly going to do what I have to do." And that's
Yeah.
exactly what I did. And I had the time of my life. And again, it just showed me that in the job setting, maybe this is not for all industries, maybe it's not for all jobs, but generally speaking, you are a warm body to
Yes.
perform a function,
Yes.
and it doesn't really matter what's going on with you or what you need. You're expected to rise to their occasion. And that definitely sent me like, okay, this something's got to give because this is not working, not at
Right.
all for
Right.
anybody except for apparently the people that make the schedule.
Exactly. And so was that kind of the tipping point for you to exit clinical medicine at that time?
That was not the tipping point. That was the start.
Mm,
I
okay.
ended up after that. I did leave shortly thereafter, and I did locum tenens for a while because I still had this tug of war. It was okay. I believe in my heart of hearts, I'm meant to be here. I was supposed to do this. I was drawn here. I fought to get
Right.
here,
Yeah. Yeah.
you know. And so, is it really that I want to leave clinical medicine altogether, or is it this particular environment of clinical medicine? So, I convinced myself that I would do locum tenens. And so, for the non medical people out there, that is essentially you are a temporary face, my goodness, place filler. You go to places that need whatever your job title is. So in my case, they needed a physician that specialized in rehab medicine. And so I got to go to different places across the country and experience their hospitals. But it was it gave me more autonomy. I could make my own
Mhm.
schedule.
Mhm.
I also could make my own pay. And it worked out for a while. The young kids that I had began to really miss me and
Yes.
started showing some signs of regression, having potty accidents at school long after being potty trained and things like that. And so, I had to make the hard decision, but it was easy at the same time. My kids need me. And again, we're back at this. Okay, is it mom?
Right.
Is it physician? Right. And so at that time, I ended up, I did go back to a clinical job. Let me see. From there, oh no. So from the traveling position was when I was like, okay, number one, all these hospital environments, they're pretty much the same. We don't really care what happens, just as long as we have a head
Right.
and a bed. And so I said, yeah, okay. I like I surrender. I can't do it anymore. And I took an exit from clinical medicine. And I will say that leaving it taught me something as well. I think being able to see the other side, because I went to an insurance utilization management role where I was the person who had to decide whether the information
Mm-hmm.
presented to me was appropriate to approve a patient to come to a rehab hospital. So I
Mm-hmm.
know the clinical side. Now I was
Right.
getting the insurance side, which was very, very eye opening.
Mm-hmm.
And this was also um, shortly before the incident with the insurance CEO being murdered. And it, that was crazy because working for the insurance company, I have the opportunity to talk to my colleagues who are at the hospital.
Mm-hmm.
I'm getting cussed out.
Yeah.
Some of the things that were said to me, oh my goodness. Somebody said they hope my mother was in a
Wow.
hospital and nobody was there for her. It was just crazy. I said, "Wow." And I really took everything that I learned, practicing medicine to apply. I'm rooting for the patient still,
Right. Right.
and I think that was the thing that was not understood. All they heard was you're denying care,
Yeah.
and there was no amount of explanation that helped really with the majority of the people that I spoke with. But um, it showed me too how much the clinical was still there,
Mm-hmm.
and how much it wasn't a matter of, oh, I don't want to do this, I have zero desire. It really was the burnout that I've had so much moral injury.
Mm-hmm.
That's really what it
Yeah.
is, moral injury, that I am trying to do the absolute best I can in a system that doesn't want us to be great,
Right.
and
Oh
it's
no, absolutely
affecting
not.
everything that we do. The patients look at us and think that we're the reason, then we're looking at the insurance company, the insurance is looking at us. It's just everybody
Right.
back
And
and
not
forth. But
nobody's talking to anybody, and they don't recognize that it is the whole system. And
correct.
that's a whole nother discussion. I
That
feel you
is
on
definitely.
so many different levels though. Because you're right. It wasn't, it sounds like it wasn't that medicine wasn't for you, but it was medicine that didn't allow you to practice in a way that honored all of your parts. Right? So
Yes.
I'm a firm believer that you can structure your life the way that, in such a way that it serves you instead of you serving
Hmm.
it. But I think we don't give ourselves permission to take that power, to really take the power and say, okay, you know what, I want this, this, and this. And if you listen to everything, I mean, when we go through the medical training, they're training us to be employed physicians.
That's what I was just
They
gonna
are not
say.
training us to own anything. They are not training us to be in
Condition.
charge of anything.
Yes.
They are
These are
training
your
us to work
options.
for them. Right. And
Hmm.
so, so they don't want you to think for yourself and to say, okay, I'm going to build my life this way so that I have this time for my family and I have this time for patients and I make this much money and I sleep this amount of, like they don't want you to think that you have the
Correct.
option of doing that.
Correct.
And I,
Yes.
and so I'm a firm believer that you do.
Absolutely. And as a result of that, because I going through this transition, I pulled back from mentoring and things as well, because I didn't want to put my kind of negative space onto someone else, especially budding medical students or pre-med
Sure.
students. And I have started with a mentee now, and that was the first conversation that we had. I said, if you don't get anything from me, I want you to know, learn as much as you can, experience as much as you can, but don't let anybody tell you these are your only options.
Right.
Because that I definitely was ingrained. You either did, in my specialty, you did inpatient hospital medicine, you did outpatient clinical, or you did a combination. Those were your options. And I'm like, I'm not super all gung ho for either
Right.
one of those. So I was like,
Yeah.
well, what's the lesser of the two? And I just kind of picked a route and, kind of meandered my way through. But I mean, I locum tenens, I get to be
Yeah.
a traveling physician, set my schedule. I had no idea that that was even a thing.
Right. Right. Exactly. I mean, and then there's so many other permutations of things, part
Hmm.
time or, half time with the job share. There are limitless options if you're willing to explore them. And I think that that's part of, again, what keeps us stuck is we don't think that we have options. We don't know that there's another way. And that's so disempowering, when you feel like you've trained all these years, you've invested so much in your career and you're not happy, you don't like it, and then people look
Right.
from the outside and they're like, okay, well, you're a whole doctor, that's
Right.
impressive, right?
What's
That's
not
impressive, you
to
should be
what's not
happy,
to
right? Aren't you
love?
rich?
False news.
Right, exactly. Yeah, talking to student loan people, talking to
Yes,
tax people,
exactly.
all of those things, all of these misconceptions about what it is to be in, a physician. But now it
Hmm.
seems that you have transitioned to something new, that you've kind of taken your power back and you're building what you want to see. Is that
That
accurate?
is that is very accurate. And something else I would add to that, outside of the conditioning, I think it also breeds fear.
Mm,
For
yes.
me, that has been the ongoing theme. What if
Mm,
it doesn't work? What will other people think? That, oh, you're a physician. Why would you want to do this, that, and the other? Or you have it made because all you have to do is show up and get a check. And, all these different things ran through my head about just it's the unknown. And you're a physician, you didn't learn any business, you know, there's a big
again, by
wealth gap.
design.
Yes, by design. Now,
Yeah.
fortunately, in my residency, our program chair was very intentional. We had to rotate with him in his clinic, and he was very intentional. We did everything in patient care from the beginning to the end. We were doing the bills and all those things. So that part we had a good understanding of, but not even the payment system. We know
Mhm.
that there's insurance, but the understanding of how that works, how how you get paid,
Right, right,
which is
right, right.
very inconsistent, is that's a whole new world. And so in thinking about what I wanted, like you mentioned earlier, I definitely did have to give myself permission to think about it. And it wasn't without, I didn't just come to it on my own. It was definitely coaches in my space. It was definitely, my mom's encouragement, my husband's encouragement. I think without those people, I probably would be still sitting there contemplating, wondering, daydreaming, all of the what ifs. And then saying, okay, this is also more than just about me, because
Mhm.
creating this is for me to be able to express what it is that I believe God has really put in me. But also now it affects the patients, it
Yeah,
affects colleagues. Because one of the things that I feel so heavy, because there are so many physicians that have been struggling with, the way that things are going, that this is either a space for them to be able to come and this will grow, and or it becomes a model of, here's what you can do, take this starting
yes.
and add on to whatever it is that your gifts and talents are, um, along with obviously impacting my family and things like that. So it's I definitely had to really step back, be in prayer, because for a while I could not even, I couldn't even think of what it is that I wanted, what it
Mm-hmm.
looked like all of that creativity, that whole thought process, a lot of the stuff that I know you do at your retreats with getting people to really hone in on that, I had zero. It was gone. And
You
now
can't do it.
I'm
You can't do it from a space of exhaustion. I mean,
correct.
that's the reality. When you're burned out like that, you can't see anything. You're basically just trying to keep your nose above water so that you don't drown. You don't have
Yes.
time for creativity. You don't have time for growth. You don't have time to even process what's happening to you.
Yes. That's very accurate. Because by nature, I'm a creative person.
Yeah.
So, the fact that it wasn't there, and I didn't even realize it. I didn't
Yeah.
even realize it until I came all the way back, to myself. So, yeah, what I'm building, and that also just gives me joy just to say, like, I'm building something,
Yes.
is amazing. So right now, I'm working with actually securing a space to work out of, probably starting 1 day a week. So I'll have in person availability, along with IV vitamin therapy, because, that's the other thing that I've noticed is, one, people are taking supplements and things which, they may or may not need. But then also, again, supplements are not as regulated, and the quality is not always good, and you end up just really wasting your money. And so that's something else that, really, we're there, but I'm looking at really having everything hitting the ground, starting January. I have a bunch of things planned, starting in January for the new year. Everybody trying to, get their new bods and all that together.
Perfect
So
timing, right?
exactly.
So now tell me this. You mentioned that had the support or advice of coaches and your family and all of that. What were you? Because a lot of times we're reluctant to admit that we're struggling and we don't seek help. So what prompted you to seek that help or that level of support?
Well, that also is one of those things that I think I was not actively seeking help at the time.
Hmm.
But as we do, we kind of silently search for different things, may Google this, scroll Facebook for that. And I came upon a physician whose name I had come across before, mostly because the name is somewhat unique, and I recognized she was a Black woman, and we had the same specialty.
Okay.
And I reached out. I think she maybe, in whatever it was that I saw online, maybe put her website, or somehow I may have even stalked her and just, looked her up and
Sure.
saw that she was doing coaching and things like that. And she had a, 30-minute call where you could just talk and see what she does and what you're looking for and see if it works. And I said I wasn't actively seeking help, but I was praying, and I would say, like, Lord, I know that there's something more. I don't
Yeah.
know what it is, but I know that this isn't it. This isn't the life you meant for me, in terms
Right.
of, how it was. Like, I wanted to make an impact, and I came across that post, and I thought, okay, 30-minute call, no costs. What do I have to lose?
Right.
And that call literally was the starting point. When we talked, things that I had not told her, that I was thinking about or questioning or considering, she brought up. It was like she knew me.
Hmm.
And I thought, Wow. Okay. Again, it was that, okay, do you take a chance or do you continue with the way that things are? And it's
Right.
like,
Well, what I'm doing
okay,
isn't working.
it ain't working. So, you know what? Let's go for
Right.
it. And working with her again was one of those things. And I've always been a person when it comes to career, I don't have a problem asking for help.
Mm-hmm.
From, as a pre-med student, I was asking questions, talking to everybody I could, tell me what do I need to do. So that was not the hard part. The hard part is asking for help in everything else,
Yes.
because now I'm going to need a different type of support at home. I'm going to need a different type of, financial support. Possibly I'm going to need these other things, and now this is personal, and I'm like, okay, this is uncomfortable. Now I have to ask for help in a different way.
Right.
And so that was definitely challenging, but again, it was at this point, closed mouths don't get fed. So,
Right.
you ask and you shall receive. That's what the Bible says. And to get something different, you got to do something different. And that was the point that I was, again, I knew that there was more. And if this is, the solution, if this is even just the starting point, I'm one step further than what I was previously. And
Yes.
so I just felt like it was necessary.
Yeah, and I just, I want to applaud you for pursuing that and being brave enough to do it, because a lot of people, and then I'm sure you and I are in a lot of the same communities, and we hear,
Mm-hmm.
a lot of coach bashing, and it's not real and it's not legitimate, and all of this kind of thing. But for the people who have done it and have seen the power of it, myself included, I
Mm-hmm.
can, it just, if what you're doing isn't working, then why not try something different?
Right.
You might end up with a whole practice, right? That makes you happy, where you're
Right.
building something, that fits with your life and allows you to practice medicine the way that you want to practice medicine and take care of the patients the way that you want to take care of them.
Mm-hmm. Yeah. Yeah. I don't agree with the coach bashing. I think now I've learned some lessons with coaches that just like people and just like physicians, all of them are not created equal.
Oh no.
You definitely
Absolutely not.
have to, you got to know something in order to know which coach is going to be right for you, the same as with anything. But it's interesting, especially in the physician community. I feel like we underutilize coaches.
Oh, for sure. For sure. It's
Other
it's it's common it's
industries,
commonplace in corporate America. Yeah, it's
correct,
commonplace.
correct.
Yeah.
So I don't know what that is. Is that a little ego or just,
I
again,
think everybody
conditioning
thinks it's
because
a
they
scam.
don't
Oh,
want
it's
us
a scam.
to, well, yeah, because people don't
I
want to
don't know.
pay.
It's hard to say. It's hard to say. But but at the end of the day, you got what you needed. And I think, if there's any lesson for me that I would take from this aspect of the conversation, is that none of us, I don't believe any of us were put here to do life alone. You
Hmm.
talked about the Bible, and I was actually looking at Second Corinthians chapter 12 yesterday, and it was talking about the all of the body, that we're all one body, and we can't function without each other. Nobody's more important than anybody else. We are equally valuable to the bigger mission. And so
Hmm.
it's short-sighted of us to try to do life on our own, to not rely on our resources, because there's always going to be somebody who has a different skill set from you, and that's by design, so that
Yes.
they can help you, and you have a different skill set from them so that you can help them. So it's all meant to be this, synergistic project, and we instead turn it into a crazy competition.
Right. Yes, definitely agree. I've always been on the everybody needs a tribe. Everybody.
Yes. Absolutely. So, we're running out of time, but I do want to ask, what's it like for you now? So now you've opened your practice, and I can see you kind of light up when you talked about what you're building. What does it feel like for you now? How can you contrast it, compare and contrast to what it was like when you were in practice before?
Oh, sure. Well, so I think the work is the work. There's things that, you have to do that I don't particularly care for when you got to, go through all of the filling out forms and contracts and all those kinds of things. But the difference is, again, I think that it's something for me that's so unique to what I see and what I offer. Whereas in practice, I'm literally I was creating, this is how I felt. I'm creating someone else's dream.
Mm,
So I
yes.
am a cog in the wheel.
Mm-hmm.
I get the satisfaction that I'm doing something that I think probably is meaningful, but at the end of the day, it was kind of okay, I go home, live my life. This more is um I feel like almost intertwined. Like what the business is represents me. It's like an
Mm-hmm.
outward visual of the things that I've thought inside or feel inside at kind of kind of presented out in the form of, medicine, how I guess it would look in my mind. And I think there is a bigger sense of pride in it, that it's not for everyone, but it's for the people that need it.
Yes.
And that's exactly what I wanted it to be. Whereas, other places, again, it was somebody else's vision and dream. And so I guess, I couldn't buy into it because it didn't fit with my own, personal, I guess, mission, if you will.
Yeah. So you had to be brave enough and bold enough to go after your dreams, and honestly, to even be honest enough with yourself to admit those dreams, right? Because a lot of
Yes,
times we won't
definitely.
even do that. We just tell ourselves these stories. That's not for me. That's for other
Hmm.
people, but that's not for me. And
Correct.
and I think that each of us is born with a dream, like I said, a dream and a purpose of our own. And when you follow that dream, there's just something really magical that happens inside, and it's
Yes,
such
that's
a
it.
blessing to you and a blessing to everybody else.
That's it. Working versus being on purpose.
Yes.
That would be the summary for me.
Excellent. Well, thank you so much for joining me tonight. I do want to give you an opportunity to tell us how we can work with you. So, if there's somebody who's interested in working with you, where are you located? What states can you service? All that kind of stuff. Give us the particulars and how we can reach you.
Oh, absolutely. So you can find me on Facebook under Dr. Dewan Carpenter. And you can also go to my website by the same name. So it's www.drdwancarpenter.com. And I am licensed in 5 states. Those include Florida, Louisiana, Georgia, Ohio, and Michigan. So, any of those states, I am licensed in. We can do an initial call, telemedicine. If you just have questions, reach out to me on social media. I do have Instagram as well. The best one is at real DRDEE. So at real Dr. D, because I saw some other people saying they were Dr. D's, but they weren't doctors. So yes, I would be happy to talk with you. If you just want to say, hey, you had a dream too. I would love to hear it. I love, hearing other people's stories and testimonies as well.
Absolutely. So all of her contact information will be in the notes on YouTube and in the comments on the other platforms. But again, thank you so much for joining me tonight. I'm so glad we finally had an opportunity to have this conversation. And I want to thank you guys for watching and joining us. Please, if you have questions, don't hesitate to put your questions in the comments, and I will get those questions to Dr. D. And we'll see you all next week. Take care. Bye-bye.
Hi, thanks.